your child requires colonoscopy. Is that scary? Right. Okay. So whenever a doctor tells that your child may require colonoscopy, we get scared. So I will just tell you a few things about what colonoscope is and what is a colonoscopy. So first of all, colonoscope is an instrument, like you can see that is there in front of me. So this is our colonoscope, hold in our hand, and there are, you can see, multiple buttons and multiple controlling panels are there through which we control the movement of our colonoscope inside the body. And this is the part which is roughly 1.6 meter long, which slowly goes inside the child's rectum and into the large intestine, and rest of the part, this is connected with the machine. So don't be scared. Okay, so this is the part which goes usually inside the body, and most of the time the whole of the colonoscope doesn't go inside. A part of it, by that time we can finish our procedure. So there are so many technical things that a gastroenterologist can understand and can explain to the individual patient, but that is what it is. The diameter of a colonoscope is roughly less than our index finger, so you don't need to worry that how painful or something it can be done. It can be, but definitely it should be done under anesthesia, so that your child doesn't feel scared during the procedure. Now the second question comes, why should my child be requiring a colonoscopy? Why our doctor tell that? So the commonest reasons I will say is blood is coming in the motion, which is not getting better over some time, or blood in the motion is too much. Sometimes when pain abdomen which is not improving, and sometimes when your doctor is suspecting diseases like tuberculosis in the abdomen, and very rarely inflammatory bowel disease. But inflammatory bowel disease is rapidly increasing in children, so we need to be careful. So now the next question comes, so if you are putting this big tube inside the child's body, how painful or how bad can it be for the kid? So one thing I would like to tell, whenever colonoscopy is done, it has to be done under anesthesia. We try to keep the anesthesia as minimum as possible. So if your child is getting colonoscopy in a center where there are pediatric anesthetists, a pediatric gastroenterologist who is expert in this procedure, so it can be done very safely. If any specific procedure related complications are there, your gastroenterologist will explain you that. So in our center we do colonoscopy whenever required, as small as 2 to 3 kg babies to as big as 18-year-old kids. Sometimes they are 80 to 90 kg. So for different kids, sometimes we use different size of colonoscopes. And now the next question comes, once colonoscopy is done, what discomfort my child can face? So I will say most of the time none. Whenever we do colonoscopy, almost all kids we discharge on the same day evening. Very rarely, if we have done some complicated procedure like we have cut a big polyp or multiple polyps were removed from the large intestine, maybe maximum we keep the kid till the next day. That is the maximum. And in my experience, usually children don't complain anything. Very rarely they say, okay, I am feeling some mild distension which may improve after passing gas or like that. So if your child is getting colonoscopy at a center which has expertise in doing it, so you should not be scared of it. But yes, you should be very clear that does my child really needs it? How will it help? What problems may happen after that? And the results, how will it affect the treatment and health of my child? So always understand these questions and then go ahead with colonoscopy without hesitation if it is required.